give us there we go. And we are live. Welcome, everyone. Excited to be here with you for another live stream event. Thank you to everyone who's joining us across the different platforms. Today, I'm honored to have a good friend with me, Tanya Abreu. Tanya is from Power Up Nursing, and we'll give her a chance to introduce herself and talk a little bit about what that is. But the reason we're doing this live stream together is we're very excited about a venture that we are launching together to bring metabolic health to the nurses, to the caregivers. And we have an exciting new program that we're developing. You'll see the link on the screen there, ifixhearts.com/powerup. If you go to that link, you can sign up for the waiting list and you'll hear about it first when it launches. So with that, Tanya, why don't you introduce yourself, give a little bit of your background, and talk about all the amazing things that you are doing for nurses at Power Up Nursing.
Oh, thank you. Well, I'm Tanya Abreu. I have been in healthcare with an emphasis on well-being care for women, and the past 4 years for nurses, for 35 years. Yeah, that's about right. And for the past 4 years since COVID, it's really become evident that nurses are the heart and center of healthcare. Um, in the words of one doctor, without the nurses, everyone would have been gone. They were warriors, they were brave, they were expert caregivers, and they were medically accurate during COVID. But at the same time, it was so obvious the cracks in their own well being, the cracks in their own sense of burnout prior to COVID, of course, escalated exponentially during COVID. And then post COVID, there was such, I guess, a great word, Philip, would be discouragement. So, Power Up Nursing is a response to that discouragement. We are comprised of an amazing dozens and dozens of nurse influencers and organizations that protect and promote the well-being of nurses as the heart of healthcare. And we are just beyond excited to launch Mastering Your Metabolic Health as the key to well-being for nurses and for everyone else. And I just want to say, Dr. Ovadia, when you presented at Power Up Nursing second annual symposium at Norton Healthcare in Louisville, Kentucky, we had a room full of like 80 nurses. And Dr. Ovadia stood up there, and the nurses' jaws literally dropped. Everybody's phone came out for Googling and note taking because nobody had really thought about an entire system of approaching metabolic health for weight loss. And we know that 60% of nurses are overweight, and 80% of that 60% are morbidly, clinically dangerously overweight. The nurses were like, what do you mean? That can affect my sleep. That can affect my anxiety, my ability to process stress. What do you mean it can affect my menopause? What do you mean it could, prevent chronic disease? So they were hungry, and they continue to be. And so many of them are listening tonight, and I'm excited for that. And I want to pass the mic over to you because people want to know. And Dr. Ovadia, my personal experience, I read your book and I was like, oh my God, no other doctor had ever told me this. When I was 340 pounds, I had to figure this out for myself. And what I figured out for myself was this beautiful Ovadia way, this 5 or 6 step program that you don't need medicines for, reverses diabetes, heart disease. And I'm like, how do we do this? How do we bring this to nurses who then really bring it to millions of Americans in need?
Yeah, that's really the vision for this partnership is, the nurses are at the forefront of medicine. I fully agree with that, doctor, right? Without the nurses, we don't have medical care. We don't have hospitals. They don't run. And quite frankly, the nurse, is the one at the bedside. The nurse is often the one in the office spending more time with the patients because the doctor's rushing off to see their next appointment, and the nurse is the one, answering the questions and things like that. So, you know, the vision here is, first and foremost, we need to take care of the nurses, and they are struggling. There are so many things, and we'll talk about some of them, that make it hard for nurses to be healthy, despite the fact that they're the keystone of the healthcare system. And of course, our hope is then that this message is spread by the nurses. We want them to learn this, to benefit from this information, so that they can then help their patients and all the people that they impact, and it can spread like wildfire from there.
Exactly.
So talk
Tell your
about,
story, Dr. Ovadia. I'm sorry to interrupt you, but tell your story, because you, like me, we're doing everything for everyone in healthcare, right? Everything, like just educating. And you are a surgeon, you're a cardiothoracic surgeon, you were saving lives, but yet your story of standing there fat, exhausted, stressed is so inspirational.
Yeah, I understand the challenges that these nurses have, and how you can be in the middle of this healthcare system and be so unhealthy at the same time. Because the first of all, the education that you get, right, around nutrition, around lifestyle, is really, minimal to start with, and most of what you learn we now recognize as the wrong information. You get educated in the food pyramid and eat less, move more. And what I observed was it wasn't working for me, and it wasn't working for my patients. And it was only when I started to get this different information, to learn about metabolic health, something that was never brought up in medical school. I don't think gets brought up in nursing school, and doesn't get talked about in the hospital, in the doctor's offices, right, where we're taking care of all these sick people that are all suffering because of their metabolic disease, but it doesn't get recognized as such. And so again, that's the impetus for this. Let's educate the nurses. Let's get the nurses healthy. Let's help them to understand what metabolic health is, how it can benefit them. Hopefully they see similar effects that I saw, right? I lost, 100 pounds. I've been able to maintain that weight loss for coming up on a decade now, which is very different. I mean, and I'm sure many of the nurses in this audience will relate, right? It's easy to lose 50 or 100 pounds. It's just hard to keep it off, and nearly impossible. And
enjoy life simultaneously.
enjoy life, right? And the metabolic health focus has allowed me to do all of that, and many other people to do all of that. So that's what we want to bring this to the nurses. What are some of the unique challenges that you see for nurses, Tanya? With all of your experience, why is it so hard for nurses to remain healthy?
This is our world right now. We're going into US hospitals around the country with a program that prevents burnout and increases a sense of well-being. And what we're finding is things just happen naturally. You start eating better, you start sleeping better, but it seems, the problems that you were asking about really start with exhaustion and not knowing what to do with not sleeping well, and your body being so fatigued that your food cravings are around glucose, immediate energy enhancing foods, not necessarily nutritious or at all good for you. So you have this, of course, stress, but stress in and of itself is not a killer. It's just that when stress is combined with exhaustion and there's no way of dealing with that, it just produces cortisol, which makes you just hang on to every bit of extra fat that your body needs because it's afraid. Cortisol is the fear hormone. And so there's a lot of nurses, and they'll talk about it, walking around clenched, walking around waiting for a hammer to fall, whether it's a patient problem, whether it's a medical error, whether it's the hospital administration's new policies that they don't agree with, whether it's their home life, whether it's the economy. It's just this constant tightness, and that tightness really causes, and we know this, right? It causes blood pressure. It causes constricted arteries, which cause cholesterol. All of that, I think, is one of the things that the Ovadia way addresses, right? Is that, you can't take blood pressure and cholesterol medication unless you're dealing with the things that are constricting all of your vessels. And I cannot talk to that as you can as a medical doctor.
Yeah, the nurses will be all too familiar with the fact that, we put Band-Aids on the problems, right? But we don't really address the underlying root cause of these problems. And, the vast majority of the chronic disease epidemic that is really, crushing the healthcare system, right? And we have this big problem in healthcare. There's a nursing shortage. But there really isn't a nursing shortage. There's an oversupply of sick people that need to be taken care of. And really what we need to do is get the population healthier. And again, starting with the nurses will be great. But unless you understand the root cause of what's causing, the disease that's in front of you, you can't really effectively treat it. And all too often we don't understand and we don't address that root cause. We just kind of put a Band-Aid on the problem. The patient has diabetes and the blood sugar is too high. And so we'll give the medication that will lower the blood sugar, but we don't address why is the blood sugar so high? What is it about the food that patient is eating or the other factors in their lifestyle that caused the diabetes in the first place? And
Yeah,
when you address that, you
I
can
remember what
reverse
you
it.
said in Louisville, which was everybody said, what? It's just so easy. Just test circulating glucose. Just test circulating glucose in the body. Doctors don't do that. We do A1Cs. We do, what is the test? What's the other test that they do when they're looking, insulin resistance, right? We don't do the insulin, just circulating insulin, a simple $8, $9 test. Now, I want to ask you, first of all, I'm going to stop for a moment and ask the nurses that are watching to sign up. Can we have that back on the screen? If you're a nurse and if you're not a nurse and you're listening to this because you believe in this whole concept of metabolic health that I'm sure you've heard of, go to ifixhearts.com/powerup. You don't have to put a credit card in. You don't have to buy anything, but you will be one of the first people to know when the metabolic health program with its own test kit will be out to the general public, which will be very soon. I think Dr. Ovadia is trying out the home kit next week, or the May 5th, next week already. So please sign up. iFix Hearts. Oh, there it is. Oh, get him back on the screen because it's so cool.
We got a special preview. So the way that we're going to design this program, you're going to be able to test at home to figure out your metabolic health. And, again, one of the challenges for nurses, they're busy, they're always working, right? Getting to the lab, getting your blood drawn, and then going to see the doctor. All of that can be kind of overwhelming. And instead, what we want to do is bring metabolic health to you. So we have an at-home testing kit. It's pretty simple. If anyone's ever worn a continuous glucose monitor, it's kind of the same concept. You just put this on your arm. There's a little blood collection vial that you snap in there, and you press the plunger, and you get your blood collection. You put it back in the kit, you mail it off, and we're going to get the markers that show us whether or not you're metabolically healthy from this test. And then you'll get, the results, and you'll have an opportunity to talk with a member of my team about your metabolic health. We're going to have educational material and stuff that goes with this as well. And our goal is just the first step, right? They always say if you can't measure it, you can't improve it. And if you're not aware of it, you can't improve it. So get tested, figure out if you're metabolically healthy or not. There are some scary statistics out there. Adults in the United States, 88% of them are not metabolically healthy, right? Only 12% of the adults in the United States are in optimal metabolic health. Unfortunately, and I haven't seen the specific data on nurses, but my gut tells me that their statistics are probably even worse than that. And so test it out, see if you're metabolically healthy or not. And then we're going to give you the tools to improve your metabolic health. And that's something else to understand about this. This isn't me fixing your problem for you. This isn't me prescribing you something that's going to, treat your problem. This is us educating you to take charge of your health and fix this problem for yourself. And that's what we're, again, so excited about this program. So get on the wait list and you'll be the first to find out when it is ready to launch.
Now, I know there's probably about half of the listeners saying, boy, I really wish Dr. Ovadia would define metabolic health for me.
Yeah, definitely. So 5 basic measurements to figure out if you're metabolically healthy or not. You want to know, first of all, your waist circumference. So this is an easy one. You can do it at home. Get that tape measure out. Measure just above the level of your belly button, first thing in the morning. And if you are a woman, your goal is for that to be less than 35 inches. If you're a man, you want it to be less than 40 inches. Next thing you're going to do is check your blood pressure. So next time you show up for your shift, have your coworker check it for you or get the device, check it at home. And you want your blood pressure to be less than 130 over 85. And that should be without the use of medications. If you're already on medication for high blood pressure, it's an indicator that you're not metabolically healthy. You want to know your blood glucose level or your hemoglobin A1C. You want your fasting blood glucose to be less than 100, and you want your A1C to be less than 5.7. You want to know your triglyceride level, and you want that to be less than 150. And then finally, you want to know your HDL cholesterol level. And, the nurses will all remember, right? That's the good one, the one that you want to be higher. And specifically, if you're a woman, you want it to be over 50. If you're a man, you want it to be over 40. So you take those 5 measurements, and that's going to tell you about metabolic health. Now, the kit's going to go a little beyond that, right? You're going to get your HDL, you're going to get your glucose, you're going to get your triglycerides. You're also going to get your insulin level, the one that Tanya mentioned before. That's so important that so many doctors don't check. And the reason that insulin is important is because your insulin level can be high. You can be what we call insulin resistant, and your blood glucose may stay okay for a while, for quite a while, actually, 5-10 years, some studies show. But that is insulin resistance. That is poor metabolic health. And that is the time that the heart disease is starting to form. That you might be getting the early stages of Alzheimer's disease, that you might be developing the chronic kidney disease, the cancer that's driven by insulin resistance. Insulin resistance is at the root of almost all of the chronic disease we face. More important, maybe, to many of the nurses out there, mental health and mood are tied to insulin resistance. And we're seeing some amazing work in the field of metabolic psychiatry, where people are actually improving, fixing things like depression, schizophrenia, bipolar disorder by addressing metabolic health and changing what they eat. And so metabolic health is incredibly powerful. We need you to know about it. We need you to improve it. And then, like I said, our hope is that you're going to then help your patients do the same thing.
And there's a book, and I think Dr. Ovadia has it behind him. And I gave away my last copy to a nurse who begged me for it. So I do have to buy another one. It's on Amazon.com, and it's called Stay Off My Operating Table. And it's really what put Dr. Ovadia on the map. It starts out with this image of an exhausted, unhealthy, overweight surgeon saying, why am I doing this? I'm going to be on this operating table soon. And it's a really powerful book. But what was very cool is the steps in there. You're going to get this book as a part of this kit. It's a quick read, probably, if you read average, like, I do, I read pretty quickly. It was 2 hours tops, but it's a really amazing book. And the aha moments I had, first of all, I don't eat red meat. I don't have an enzyme that processes it. But Dr. Ovadia is all about the carnivore diet. And if you guys remember, a lot of you nurses that were a part of life in the clinics in the 80s and 90s, it was either Atkins or it became South Beach, and which and Mediterranean, even really heavy on the non-simple carbs and really heavy on healthy proteins, and not to be afraid of red meats, and not to be afraid of bacon, not to be afraid of things that traditionally, high in fat. And there's a whole chapter on fat in Dr. Ovadia's book. The thing that struck me, though, is how much a cardiothoracic surgeon talked about stress, mindfulness, sleep, as well as a diet that flips the food pyramid literally on its head. So all that stuff that's at the at the bottom gets flipped to the top. And it's crazy, like why were we eating like that? Now, there are some conspiracy theories, Dr. Ovadia, that says, well, we had the farmers industry and they were grains, and we had the dairy industry, so they wanted ice cream and dairy. Whatever it is, it's not the best way for people to eat. And we have all the research, whether it's from the blue zones around the world where people just expect to live over 100, or whether it's from, clinical trials here in the US. So Dr. Ovadia's style of treating and reversing heart disease is based on eating all you want of the good foods that your body needs to be healthy. It's also about letting your body rest from food. I mean, most of us in the healthcare industry, or those of us who are busy, eat at 8, 9 o'clock, then we get up and, oh yeah, we were supposed to eat a bagel now. And it's just not, it kills you. It's literally killing us. And then, this whole idea of, someone says, I didn't get any sleep last night. And then there's always someone who says, oh, I got nothing. You always have to up somebody in stress, up somebody in sleep. But that's literally killing us in healthcare, killing your patients. And so the advice in the book and the advice in the metabolic health program is simple. It's clean living. It's living with joy. And I will tell you, and you guys know this, it's not going on a diet doesn't make you happier. As a matter of fact, the way most of us go on a diet to lose weight is all stressful. I can't have what I want. I have to go to the gym. This is awful. That's not going to cause any kind of lasting weight loss. But if you wake up in the morning and say, oh my gosh, look at this abundance of food that I love that I can have, and I can eat everywhere. I've eaten dinner with Dr. Ovadia, and I'm just looking, you lost 100 pounds eating like this, Buster? But it's true. But more importantly, when I eat like that, not only do I maintain almost a 200-pound weight loss over the past 25 years, but I feel younger and more joyful. I'm going to be 63 next week. And I haven't felt, and I swear on the lives of my grandkids, I haven't felt more beautiful and energetic. Yeah, my knees hurt a little more than they did when I was 30 and really overweight, but that's aging and I can deal with that. But the truth is, I have a lightness in me, and a light that comes from healthy metabolic health. My doctor, my endocrinologist says, you know what, I can't get you metformin anymore because you've had under 6 as an A1C for more than 2 years. And I'm like, well, shoot, what do I do? So thank you for this, Dr. Ovadia. And I
Yep.
just want people to share this joy.
Yeah, that's what we want. We want our nurses to feel better and to just be able to do all the amazing work they do better ultimately. And it starts with metabolic health. Love the passion that you have. Love the passion that you have for nurses and helping nurses. And so, come join us. The metabolic health revolution is here. You hear it talked about more and more. You see it in the news even these days. And so start with yourself, figure out, are you metabolically healthy? What do you need to do to get metabolically healthy? And come join us. So once again, ifixhearts.com/powerup. That's going to get you on the wait list. And as soon as we're ready to launch, you'll hear about it first. Really excited about the program. Look forward to working with all the amazing nurses. Look forward to, this partnership with Power Up Nursing, and you'll be hearing more. Go sign up on the wait list, and that's how you're going to get all the news around it.
Yes,
So
and I
thank
just
you.
want to add to that. PowerUpNursing.com is our website, and you can sign up there and you'll get blogs about iFixHearts and the metabolic test as it becomes available. And also at our upcoming events, we are having a glamping retreat for nurses. And one of the channels as we sit by the fire is really overhauling our metabolic health and really working together in healthy ways to change not just how we eat, but how we live. I love the whole idea of iFixHearts. And I remember the first time I met Dr. Ovadia, we were in a Starbucks, and he said to me, "I don't just fix hearts. I would be not a very good doctor. I fix lives." And that's what we're going out to do. So powerupnursing.com. You can come along with us camping. You can come to our big meeting here in Miami next July, not this one, but next July, June or July. I can't remember the dates. It's online, but it's all going to be about how nurses are revolutionizing healthcare. Thank you for having me,
Yep.
Dr.
Thanks for being here, Tanya. And thanks to everyone to taking some time out of your busy day. We always look forward to hearing from you. As a reminder, whatever channel you're on, if you can follow or subscribe, we here at iFixHearts, we're doing live streams multiple times a week now, and love connecting, love hearing. Drop the comments with any questions or future topics you want to hear about. And again, ifixhearts.com/powerup. Get on the wait list, and we look forward to working with all of you very soon.